Good evening. As India crosses the grim 4 lakh mark, there is a complete lockdown that's been announced in Chennai for a period of 12 days. Delhi data is worrying, but there are flip-flops over whether institutional quarantine should be made mandatory or not. To take stock of India's COVID-19 battle this evening, we have Dr. Randeep Guleria, the director at the All India Institute of Medical Sciences, joins us. Appreciate you, doctor, for taking out the time of day to answer our questions. I want to begin by asking you about this whole debate in Delhi around institutional quarantine versus home quarantine. What's the best for COVID patients? Despite the ICMR guidelines, there appears to be a fair bit of confusion.
Yes, so I think the main thing to understand is that home quarantine is something which is very useful for people who can maintain that home quarantine. That is, you have to have the facility for isolating yourself, and you should be able to make sure that you don't give the infection to others. So what I think is happening in Delhi, and this is possibly what led to all of this confusion, was that a large number of people who were positive were isolating themselves at home or had opted to isolate themselves at home, but did not have the capacity or the ability to do so because they were living in a small house, or they didn't have the facilities out there, or they were not sincere enough to really follow the rules of home isolation. And the surveillance data therefore suggested that possibly there were clusters developing in certain areas where people were isolating themselves at home voluntarily but not following the rules and regulations. I think it's important that we encourage people to have home isolation, but with the caveat that it should be possible for them, they should have that facility, and it should not lead to infection spreading in the neighborhood or among their own family member. If such a situation exists that you are, say, 5 people living in one room, is no way that you can isolate yourself. Everyone in that room will get infected, and a better option then would be to go to an institutional facility, because that is the only way one can prevent the spread of infection and develop or decrease the number of cases as far as Delhi is concerned.
All right. So you're essentially saying that the rules need to be case specific in a certain sense. But, I want to just shift our focus once again to what's happening in Delhi. Worrying news coming in today of all healthcare workers who've been called back from their leave. Only emergency leaves will be granted. Mumbai is reporting a shortage of beds. They've now said that only asymptomatic patients can be asymptomatic patients should not be admitted. I beg your pardon. Can the health infrastructure support a pan-India mandatory institutional quarantine? It exists despite the ICMR guidelines. There is mandatory institutional quarantine in Uttar Pradesh, for instance. Is it sustainable in the long run?
So when you're looking at quarantine, as far as asymptomatic or mildly symptomatic individuals are concerned, it's not a hospital-based quarantine. It could be in a COVID care center. It could be what we call paid isolation facilities. It could be hotels which are giving subsidized room. It could be high-end hotels also. So it's not actually a facility which is causing impingement on the health resources. I think the health resources are required for sick patients who have moderate to severe illness, whereas the COVID care facilities, which could be the government facility or a paid facility, are basically, or home isolation, are basically for mild patients and for those who are asymptomatic. By doing this, we could decrease the load on the hospitals, and sick patients could be managed appropriately. At the same time, it will also allow better management of these individuals who are otherwise asymptomatic. 80% of individuals, or more than 80% of individuals, actually have very mild or no symptoms, need more of reinsurance. And I think if we have a mechanism of teleconsultation, talking to them regularly and being able to support them, and also a backup that in case anyone deteriorates, then we can move these patients to a hospital, then having a COVID care center or a paid isolation facility along with the hospital will make much more sense in terms of being able to distribute the number of cases and thereby provide better care to those who are in the hospital.
Right. Dr. Guleria, if I can just ask you a quick follow-up question to that. Who then takes care of COVID positive patients? If it's not a hospital and if it's just a quarantine facility, you still need trained staff, etc., to be present there. High level of, hygiene, sanitization, dietary supplements, etc., need to be taken care of.
Yes, so you need a good sort of, let's say, organization skills but you don't need health, the amount of manpower that you need in terms of the, let's say, doctors or the healthcare resources are not as much as you would say required in a ward or in the ICU.
Right.
So you could manage with a lesser degree of manpower and more volunteers who could support it with a backup. So you could have people who could monitor the oxygen saturation, the pulse, look for any symptoms, look for the warning signs, and provide some degree of support. But it doesn't have to be run like a ward where sick patients are there, or like an ICU where even a large number of healthcare resources are required.
So you're essentially saying this would be a move to prevent the spread of the infection, especially in areas where social distancing is not possible. You know, I want to come back to this whole point of no hospitalization for asymptomatic patients in Mumbai. You know, there's no more mandatory quarantine in Delhi, but there is mandatory quarantine for COVID-19 patients in Uttar Pradesh. So different rules applied in different states, irrespective of there being, you know, an ICMR guidelines that one can follow. Do we need a uniform COVID policy in place?
So I think we do need a uniform COVID policy, and we need to really have all the health experts, the epidemiologists, the policy makers to sit together and develop a uniform policy. But having said that, there are two other important things to remember. One is that health is a state subject, and secondly, issues may be different in different areas. For example, the slums in Mumbai or the urban slums that we see in Delhi have a huge challenge which is totally different from what you could see in other cities.
Right.
The population density is different, the type of movement that's happening is different, the type of crowding that we see is different. So there has to be a uniform policy, but it has to also have the flexibility to change depending upon the area that you're looking at and the micro planning that is needed there. We can't have a similar policy which would be, say, in a smaller town or rural India, and which would be applicable for Delhi or Mumbai. Different scenarios, different type of population density, different solutions.
All right. So you're saying we need a uniform policy perhaps, but how that policy is implemented, you know, can depend on what the situation prevailing in different states is. I want to come, down to the other big development that's happened this week, which is the 12-day complete lockdown, which has been announced in Chennai. Can another lockdown perhaps help the COVID crisis in Delhi? The numbers are looking grim, or elsewhere, where we are seeing a spike. Do you believe that going back to periodic lockdowns is a solution?
So this has been done. China has done it more recently. Singapore did it. So depending on the situation and the right number of cases and the strategy that is developed, a lockdown which could be in a limited area or in a larger area can be a possibility that can be looked at. But sometimes it may be important in certain, say, containment zones or hotspots, because you don't want the infection to spread from those areas to areas where you don't have a large number of cases. And secondly, you would like to really be more aggressive in these areas where there is a large number of cases in terms of good surveillance, extensive testing, isolation, and making sure that those people there are protected and the illness doesn't spread from these areas to other parts of the city. So I think there is some merit in looking at lockdowns in different areas as the pandemic evolves and behaves differently in different parts of the country.
But if you just look at Delhi, Dr. Guleria specifically, what's your assessment? You know, the numbers in Delhi look particularly grim. The positivity rate in Delhi, has touched 33%. What would you recommend at the moment if you look at the scenario today?
So I think what we need to do is look at areas where there are an increasing number of cases, or what is these areas, and then develop an aggressive containment strategy, which could also be having an aggressive lockdown in these areas. Also do a lot of testing in these areas to make sure that we are able to trace all those who are infected, isolate them. If they cannot isolate themselves at home, isolate them in a COVID care center so that they don't spread the infection, and when one can break the chain of transmission. Make sure that this area is really properly sort of contained, the perimeter is controlled properly, and also have a policy of looking after those who are sick so that we can prevent the mortality also in these areas.
Right, but if this Chennai lockdown does actually yield, because Chennai is completely gone into lockdown along with 3 other districts, what you're suggesting is a more hyper-local approach, if I understand you correctly. But if this Chennai model does prove to be successful, do you anticipate that especially in cities and urban areas where you yourself have said that there have been clusters of infections, where the infection rate is higher, where COVID cases are spiking, we could perhaps be spiraling back into a situation where we're looking at periodic lockdowns?
So that is a possibility. It will depend how things evolve over the next few days or weeks. If we find that they're really going out of control and we're having a huge number of cases and there is a need to have a lockdown, that is a possibility that one can also think of. It depends on how the situation evolves. At this point in time, I think if we work aggressively on looking at the areas where there is a large number of cases and develop an aggressive containment policy, or let's say limited lockdown in different parts, we may get away. But I think that will depend how things evolve. And if that doesn't work, you will have to look at a more aggressive strategy.
All right, a more aggressive strategy if the numbers continue to spike. But we're talking to you on a day when India has crossed the grim 4 lakh cases mark, Dr. Guleria. How soon can India flatten the curve? Is it anywhere in sight?
So that's a difficult question. The number of I think the curve will sort of flatten in different parts of the country at different times. It seems that the number of cases will rise for maybe a few more weeks and then only will it flatten. It's important to remember that the number of cases in our country will be significant because of the fact that our population is so large. If we start looking at our population, it accounts for many countries in Europe. And therefore, the number of cases will be large. If we actually look at the number of cases per million population, then the number is not that large. But my feeling is that it's not the numbers that will really make a big difference at the end of the day. What will really matter is the mortality. So if we are able to keep our death rate low, if we're able to protect our senior citizens, our higher risk population, and if we are able to provide good quality care and the mortality is low, then I think it's a better way that we've come out from this pandemic rather than just focusing on the numbers.
Right. And, once again, I know we repeatedly asked you this question, but yet again, because, we've crossed that grim milestone of 4 lakh cases in India, has India moved to the next stage? Are we in the stage of community transmission?
So there was the ICMR data which was released a few days ago, and that looked at zero surveillance of the entire country. And if you look at the data from the entire country, definitely we are not in a state of community transmission as far as the whole country is concerned. But like I've said in the past, that if you start looking at hotspots or areas where there is a large number of cases being reported, whether it's from Delhi or Mumbai, some degree of local community transmission in these hotspots is possible. And that is why I'm saying that we need to have a very aggressive strategy for these areas, which cannot be the same for the whole country. And that is why a lot of micro planning for larger cities, for areas where there is an increasing number of cases needs to be done. And that type of strategy has to be aggressive, where there is a lot of testing, tracing, isolation, and we also have a strict containment in these areas so that the infection rate comes down. As a matter of fact, if the infection rate from these hotspots starts coming down, we will see a decline in the number of cases.
But there has been, just because you're talking about a containment strategy, as a possibility to deal with the spike in cases, there has been a change in strategy initially in the initial days of the virus, when there would be a case in a particular area, for instance, or a particular home, the entire society would be in lockdown. Now it's more specific to the particular building or just to the floor if it's a workspace. Do you believe that a little bit of leniency that one has seen in the strategy in dealing or containing COVID-19 needs to be revised or re-looked at given the spike in cases?
So I think also what has happened over a period of time is that we've learned more and more about the virus, how it transmits itself, how it behaves. And based on that, the guidelines have changed, our knowledge has changed. We used to insist on 2 tests after 14 days before saying that the person is non-infectious. Now we know that you are non-infectious after the 7th to the 10th day if you are asymptomatic or you have no symptoms for 3 days. And because of that, the policy has changed that no testing is required before you're sent home if you're all right for 10 days without any symptoms. So we are learning as the pandemic evolves, our knowledge also evolves. And therefore, I think the aggressive strategy that we had in the beginning of the whole locality being locked down would probably not be correct right now. But I still believe that we need to be aggressive in testing, in tracking, tracing, and also in aggressive isolation. We have to break the chain of spread. And I also believe that every citizen has to feel a responsibility in participating in this endeavor that we don't allow this virus to spread. So when we go out, all the precautions, whether it be wearing a mask, whether it be social distancing, whether it be washing your hands, have to be aggressively followed. Then only will we prevent this infection from spreading to other people.
Right. Dr. Guleria, because you've talked about community participation and people coming forward, self-reporting, for instance, if they have symptoms, getting themselves tested, following isolation guidelines. I want to ask you another question, going back a little bit to what we were talking about, the mandatory institutional quarantine that is in place, in certain parts. Do you believe it's a deterrent? Do you believe it instills a sense of fear among people? They're then hesitant to report symptoms or go get themselves tested?
So I believe that is one possibility, and that is why I think that we have to be a little liberal as far as isolation is concerned, because very often we should not have a strategy where the person is discouraged to report and to the healthcare facility. This has two implications. One is the disease will continue to spread and we will not be able to control it. And that's why I think one should not be shy away or feel any stigma that if he has fever, symptoms which could be COVID. Right. Second is that it may also contribute to increasing mortality. There have been cases where people, despite having symptoms of COVID-19, do not go to the hospital, delay their reporting to the emergency department until they become very sick, and they come in a state when they are about to collapse, and a large number of these individuals have died within a day. Therefore, I think it's also important that people report early to the hospital when they have moderate illness so that they can be treated aggressively. Sometimes it's just oxygen that they need, and with that, there can be a mortality benefit also.
All right. It's interesting because you've also talked about aggressive testing, something that you've stressed upon. The ICMR has approved one more kind of diagnosis for the COVID-19, which is the rapid antigen detection test. It's to be used in specific settings. Dr. Guleria, could you explain, to our viewers, what is this this rapid antigen testing and how is it different from the other forms of testing?
So we had a classical testing that we have is that you take a nasal swab, it goes to the laboratory where we use what is known as RT-PCR. It's a machine and it takes a long time, sometimes about 6 to 8 hours to give you a report, and that tells you whether you are having the virus in your nose and throat and whether you have COVID infection. We had the antibody test, which we discussed a few weeks ago, which is something which comes later on after 14 days. The antigen is also looking for the virus. And what this does is, this is like a card test. So again, a swab is put into your nose. And after that, the swab is put into a small bottle or a small vial where the virus is killed, but the fragment of the virus stays there. And then 2 drops of this are put onto a card, a small card, which is like you do for a pregnancy test. You put 2 drops. And then in 10-15 minutes, if a line is formed, there is a control line and another line, if there is a line which is formed, it tells you that the test is positive. So you will come to know within 15 minutes whether this nasal swab has the virus. Now there are 2 caveats. One is that this is a good test, and if it is positive, it is definitely positive. We have done studies of 250 patients in our hospital and shown that if comparing it with the RT-PCR test, that this rapid point of care diagnostic test, if it picks up the virus, it is definitely COVID-19. The downside is that if the viral load is less, the test may be falsely negative. That is, if the test doesn't pick up, is not showing the infection, you may still have COVID-19, and therefore you should go for the RT-PCR test if it is negative. So a positive test definitely tells you that you have COVID-19, but a negative test doesn't rule it out, and you should again get yourself tested if you have symptoms. But it gives the result in just 15 minutes. So It can be done in a home setting, it can be done in schools, it can be done at your house. So you could get a rapid diagnosis, and one could isolate these people who are positive as early as possible, and that would be a huge advantage. It's a cheap test, it's not very expensive, it can be done in schools, in a polling booth, or even at home, and that is the basic advantage of this test. But remember that if it is negative, it doesn't rule out COVID-19 infection.
Right, very interesting. So you're saying the efficacy of the test is great, but the accuracy is still not 100%. I want to also ask you about new treatments. We're reading about new drugs that are being tried, new drugs that are being allowed in the market. Fabiflu is something that has been touted as a possible drug to treat coronavirus. Could you tell us more about it, Doctor?
So favipiravir, which is now introduced in India, is a drug which is also an antiviral drug. It was introduced in 2014. It is a Japanese drug, and it was actually introduced for the treatment of influenza, for H1N1 or swine flu, and was found to be useful as far as treating influenza was concerned. However, this is an antiviral drug which has an efficacy against a large number of what we call RNA viruses, and it was found to be useful in other viruses. There had been studies in the past where it was even used for Ebola virus, and some studies even used it and showed it may be beneficial. More recently, with COVID-19, there have been some studies predominantly from China and some from Japan, which also tend to show that this may be useful in the early stage as far as treatment of COVID-19 is concerned.
Right.
And now an Indian company has started marketing it in India. It's available in India, and therefore it could be another drug which one could use. However, having said this, like the other drugs, we still need more evidence to show how effective it is and how useful it is. But currently, as the pandemic evolves, any new drug which may be of some use is good to have in our armamentarium. And I think it's something that we can use because it is again easily available in our country.
Right, and of course all of this comes with a rider that even if this drug is available, please only absolutely take it under medical supervision with a prescription from a doctor. Yes. Dr. Guleria, the World Health Organization today said that the pandemic is in a new dangerous phase. What does this mean for India?
So if we start looking at the data, and this is not only from India, but from other parts of the world, even from South America, there are new areas where the cases have started appearing and increasing. And also a lot of things have happened over the last few weeks, which may be helpful for the surge of cases or new increase in number of cases, whether it's Europe or it's America. So it seems that we may have a new surge in the number of cases over the next few days or weeks because of the fact that the lockdown or the isolation which one was promoting very strictly didn't get implemented because of other things that happened globally, and also because of the newer surge which has happened in South America. So there is now at a global level an increase in number of cases. Plus globally also in many parts of the world there has been an ease in restriction, and that may also have an impact as far as the number of cases are concerned at a global level.
All right. So as of course, lockdown restrictions are eased globally, there is bound to be a spike in the number of coronavirus cases. As always, Dr. Guleria, thank you so much for being so patient and taking on all our questions this evening. We look forward to this conversation with you next week once again.
Thank you very much.
Thank you for watching.